If you're over 60 and still dealing with joint pain, nerve pain, or constant fatigue, even after taking vitamin B12, K2, and magnesium, then listen carefully because what I'm about to share may completely change the way you understand your body and your pain. Most people believe that once they start taking the right vitamins, their body should begin to improve. They expect the stiffness to ease, the pain to reduce, the energy to come back. But if that hasn't happened for you, if your back still aches, your knees still feel heavy, your nerves still burn or tingle, then your body is trying to tell you something deeper. There is another deficiency, one that is rarely discussed, rarely tested properly, and almost always overlooked, even in people who are doing everything right. And until this missing piece is addressed, your body will continue to struggle no matter how many supplements you take. Over the past 22 years working with seniors, I have seen this pattern repeat again and again. People come in with lists of supplements. They are disciplined, consistent, and genuinely trying to take care of themselves. They take vitamin B12 for their nerves because they've been told it helps with tingling and numbness. They take magnesium because it's supposed to relax muscles and improve sleep. They take vitamin K2 along with vitamin D because they've heard it supports bone health. On paper, everything looks perfect, and yet when you sit across from them and actually listen, the story is always the same. The pain is still there, the stiffness is still there, the fatigue never fully lifts. And slowly, quietly, they begin to accept something that is not actually true. They begin to believe that this is just what aging feels like, but it's not. Aging does not automatically mean daily pain. It does not mean waking up stiff every morning or feeling exhausted by the afternoon. What I have learned over the years is that in many of these cases, the body is not failing. It is undernourished in a very specific way. There is a missing link that no one has connected yet. And one of the most common of these missing links is potassium. Now, before you dismiss that as something simple or unimportant, I want you to stay with me because potassium is one of the most misunderstood nutrients in the human body. Most people think of it as something related only to heart function or something doctors check in basic blood work. But what they don't realize is that potassium plays a critical role in how your muscles contract and relax, how your nerves send signals, and how your cells maintain their internal balance. Every time you move, every time your heart beats, every time a nerve sends a signal from your brain to your body, potassium is involved. It is not optional, it is foundational. Here is where the problem begins. As you get older, your body's ability to maintain optimal potassium levels begins to decline. Your kidneys become less efficient at conserving it. Many medications that are commonly prescribed to seniors, especially for blood pressure, increase potassium loss. At the same time, dietary intake often decreases. Meals become smaller, food choices change, and many potassium-rich foods are not eaten regularly anymore. What happens next is subtle but powerful. You enter a state of chronic low-level potassium deficiency. Not low enough to trigger an emergency or show up as a red flag in basic tests, but low enough to affect how your body feels and functions every single day. When potassium is not at the level your cells need, your muscles struggle to relax fully. This leads to that constant tightness you feel in your back, your legs, your shoulders. Your nerves become more sensitive and more easily irritated, which can show up as tingling, burning, or even sharp shooting pain. Your energy production at the cellular level becomes less efficient, leaving you feeling tired even when you've rested. And perhaps most importantly, low potassium contributes to increased inflammation inside muscle and nerve tissue, which means your pain is not just mechanical, it is chemical. It is being driven from within. I remember a patient who came to me after trying everything she had been told. She was 70 years old, active, careful with her diet, and very consistent with her supplements. She told me her biggest frustration was not the pain itself, but the lack of improvement. She felt like she was putting in the effort but getting nothing in return. When we looked deeper, we found that her potassium intake was far below what her body actually needed. Not dangerously low, but consistently insufficient. We made a simple adjustment. We focused on increasing potassium through her daily food, not dramatically, not all at once, but consistently. Within a few weeks, she began to notice changes. Her legs felt less heavy in the evening. The tightness in her lower back was reduced. Her sleep improved because her muscles were no longer in a constant state of tension. It wasn't a miracle. It was a correction. This is what I want you to understand. Your body is incredibly intelligent. It knows how to heal, how to repair, how to rebalance itself, but it can only do that if it has the resources it needs. And when even one critical element is missing, the entire system becomes less efficient. You can support one pathway with B12, another with magnesium, another with K2, but if potassium, which is essential for nerve signaling and muscle function, is lacking, the overall result will always feel incomplete. So what can you do starting today? The first step is awareness. Simply recognizing that this could be part of your picture is powerful. The second step is to begin supporting your body with potassium-rich foods in a consistent and realistic way. This is not about extreme changes or complicated diets. It is about simple additions: a banana in the morning, half an avocado with your meal, a serving of cooked spinach or beans during the day. These foods are not exotic, they are not expensive, but they are incredibly effective when used consistently. Another important factor is balance. Potassium does not work in isolation. It works alongside sodium and magnesium to maintain proper fluid balance inside your cells. This means hydration matters, but not just plain water. Your body needs electrolytes to actually move water into your cells where it is needed. Without that, you can drink plenty of water and still feel dehydrated at a cellular level. As you begin to make these small changes, pay attention to how your body responds, not just in terms of pain, but in terms of how you feel overall. Your energy, your muscle tension, your sense of ease in movement, these are the signals that tell you your body is moving in the right direction. And remember, this is not about perfection, it is about consistency, small daily improvements that build over time. I also want to mention something important for safety. If you have been diagnosed with kidney disease or you are taking medications that specifically affect potassium levels, you should speak with your doctor before making significant changes. This is not about ignoring medical guidance. It is about working with your body in a way that is both effective and safe. What I hope you take away from this is a sense of possibility, the understanding that your current state is not fixed, that there may be a reason your body has not responded the way you expected, and that sometimes the answer is not more medication or more complex solutions, but a simple correction that has been overlooked. So if you've been feeling stuck, if you've been doing everything you were told and still not getting results, consider this. Consider that your body may be missing one key piece, and by restoring that piece, you may finally begin to feel the change you've been waiting